Chapter 2 Pattern Differentiation of Warm Diseases 主要介绍温病的辨证纲领及卫气营血和三焦辨证。This chapter mainly introduces the guiding frameworks for pattern differentiation in warm diseases, namely the differentiation according to Wei, Qi, Ying, and blood, and the differentiation according to the Sanjiao. 一、卫气营辨证 Pattern differentiation. According to Wei, Qi, Ying, and blood, 卫气营血辨证是清代医家叶天士创立的一种温病辨证方法，用以划分温病发展的不同阶段，归纳不同阶段的症候类型，说明温病的传变规律，标明病位的前身和邪正斗争的盛衰，确立不同阶段的治疗大法，从而有效地指导温病临床的辨证论治。Pattern differentiation according to weight, Ying, and blood is a method of differentiating warm diseases established by the Qing dynasty physician Ye Qianqi. It is used to divide the different stages in the development of warm diseases, summarize the types of patterns seen at each stage, explain the laws of disease transmission and transformation, indicate the depth or superficiality of the disease location, and the relative strength or decline of the struggle between pathogenic qi and righteous qi, and establish the major treatment principles for each stage, thereby effectively guiding clinical pattern differentiation and treatment of warm diseases. 卫气营血辨证产生的理论依据 1. The theoretical basis formation of Wei Qi Ying blood differentiation. 卫气营产生的理论依据主要是内经的有关论述。The theoretical basis for Wei Qi Ying blood differentiation mainly comes from relevant discussions in the Huangdi Neijing. 灵枢本章说，卫气者，所以温分柔，非犀利，撕开合者也。The 灵枢 Benkang states was that which warms the flesh, fills the skin, enriches the coolie, and governs opening and closing. 有说，卫者，歪而为酷也。It also says, Wei means guarding the exterior and securing the body. 指出了卫气散布于体表，有温养肌肤、气闭汗孔、抵御外邪的作用。This indicates the Wei Qi is distributed on the body surface and has the functions of warming and nourishing the skin and flesh, opening and closing the sweat pores, and resisting external pathogens. Qi 是脏腑功能动的动力，同时也是一种细微的物质。Qi is the driving force of the functional activities of the Zangfu organs, and at the same time, it is also a subtle material substance. 正如灵枢诀气所说，上焦开发，宣五谷味，熏肤冲身，泽毛乌路之盖，是为气。As the Lingxi says, the upper jiao opens and spreads, dispersing the flavors of the 5 grains, steaming the skin, filling the body, moistening the hair, like mist and dew, irrigating. This is called qi. 当然，气的范围很大，卫气是形于表之气，是气的一部分固化甚至精微物质，主要是滋养机体的作用。Of course, the scope of it, Wei Qi is the qi that moves at the exterior and is one part of qi. Ying qi is different. It is the refined essence transformed from water and grain and mainly functions to nourish the body. 如苏文基论所言，营者水之精气也。和调于五脏，撒沉于六腑，乃能入于脉也。As the Suwen, Ying is the essential qi of water and grain. It harmonizes and regulates the 5 Zang organs, is distributed to the 6 Fu organs, and then can enter the vessels. 说明了营入于脉，变化而气，则为血。This explains that Ying enters the vessels, and when it transforms and becomes red, it is called blood. 如灵枢血可云，营气者，密其精也，注之于脉，化以为血，以溶丝末，内注六腑。As the Linke says, Ying qi secretes the fluids, pours them into the vessels, transforms them into blood, nourishes the 4 extremities, and internally flows into the 5 Zang and 6 Fu organs. 可见，营血相比较，因为血的前身血乃营气化相比较，则气属阳而主外，血属阴而主内。It can be seen that, compared with blood, Ying is the precursor of blood, and blood is formed through the transformation of Ying qi. Compared with blood, Ying qi belongs to Yang and governs the exterior, while blood belongs to Yin and governs the interior. 正是卫气营血在生理上的前内外不同部位，成为一天是饮食温病辨证的理论根据。 It is precisely the physiological distinction of wei, qi, ying, and blood in terms of superficial and deep, exterior and interior locations that became the theoretical basis for Ye Tianxi to extend these concepts into the differentiation of warm diseases. 2. 微气营血的症候特点。2. The pattern characteristics of Wei Qi, Ying, and blood. 1. 微分症。 1. Wei level pattern. 微分症是邪气初起，致使非师宣讲微湿开合，出现一系列微外功能失常的表现。The Wei level pattern occurs at the initial stage of pathogenic invasion, causing the lung to lose its function of diffusion and descent, and Wei Qi to lose its proper opening and closing function, resulting in a series of manifestations of dysfunction in the body's exterior defense. 其特点主要是发热、恶寒，同时并减半无汗或少汗，口微变尖红、脉速等。Its main features are fever and aversion to cold appearing at the same time, accompanied by absence of sweating or slight sweating, mild thirst, redness of the tip and edges of the tongue, and a rapid pulse. 由于风热之邪从口鼻手而入，故恶寒情，与风寒表症中而发热情不同。Because wind heat pathogen is received through the mouth and nose, there is fever with only mild aversion to cold. This differs from a wind-cold exterior pattern, in which aversion to cold is severe and fever is mild. 由于微湿开合，毛窍气闭失常，无汗或少汗。Because Wei Qi loses its ability to govern opening and closing, and the hair pores no longer open and close normally, there may be no sweating or only slight sweating. 热伤津液则口渴，伤津清故口微渴。Heat injures the fluids and therefore causes thirst. Because the injury to fluids is relatively mild, the thirst is slight. 舌边尖红，脉浮数均为邪热在位之下。Redness of the tongue tip and edges and a floating rapid pulse are both signs that pathogenic heat is at the Wei level. 此外，由于感邪不同或体质差异等素，微分病变有多种症型，如风热细微、燥热细微、阴虚感温、数为寒热等。这些具体症候在以后论述。In addition, due to differences in the invading pathogen or differences in constitution, Wei level disease changes may present as various pattern types, such as wind heat attacking the Wei level, dryness heat attacking the Wei level, warm disease in a yin deficient constitution, and summer heat constrained by cold. These specific patterns will be discussed later. 2. Qi level pattern. 气分症多由微分传变而来，但也可由温热邪气直入而至。病变主要表现为各脏腑功能的亢奋，邪气盛而正气不衰最为剧烈。The Qi level pattern mostly develops from transformation of a Wei level pattern, but it may also result from warm heat pathogen directly entering the interior. The disease changes mainly manifest as hyperactivity of the functions of the various Zangfu organs. Pathogenic qi is exuberant, while righteous qi has not yet declined. So the struggle between righteous qi and pathogenic qi is at its most intense. 症热热而不恶寒，口渴、太黄燥，身子焦黑其次，没速有力。Symptoms include fever without aversion to cold, profuse sweating, thirst, a red tongue, a yellow and dry coating, and in severe cases, a scorched black coating with prickles. The pulse is rapid and forceful. 气分病变部位广泛，可涉及肺、胸膈、胃、大肠、膀胱经更为复杂。The disease locations of qi level patterns are broad and may involve the lung, chest, and diaphragm, gallbladder, stomach, large intestine, bladder, and so on. Therefore, the pattern types of the qi level are more complex. 临床需根据各个脏腑的病特点进行定位诊断。Clinically, one must determine the disease location according to the pathological characteristics of each Zangfu organ. 如在七分共同见证的基础上，渐渐咳嗽而传，可以为邪热由肺。For example, on the basis of the common manifestations of a qi level pattern, if there is also cough and wheezing with expectoration of thick yellow phlegm, this may indicate pathogenic heat congesting the lung. 渐渐腹胀痛，胆燥结者可以为热结大肠。If there is abdominal fullness, distension, and pain with dry bound stool, this may indicate heat binding in the large intestine. 余结防此故不类序. The rest may be understood by analogy, so they will not be discussed in detail here. 3. Ying 分证 Ying level pattern 因为血之前身，故Ying 分证是学分的较主要表现为阴热阴伤的症候。Ying is the precursor of blood. Therefore, the Ying level pattern is a relatively superficial stage of the blood level pattern and mainly manifests as a pattern of heat in Ying with injury to Yin. 且阴气通于心，心包为心之外围，待心受邪，故邪而入阴往往逼阻心包，出现神志异常。Because Ying qi communicates with the heart, and the pericardium surrounds the heart and receives pathogens on behalf of the heart, when pathogenic heat enters Ying, it often blocks the pericardium, resulting in abnormalities of consciousness and spirit. Ying 分辨出两大类型，阴热阴伤和热逼心包。Ying level disease changes mainly fall into two major types: heat in Ying with injury to Yin, and heat blocking the pericardium. 阴热阴伤，针见身热也甚，心烦不慰，甚则时有心语，口干而不甚可饮。When heat in Ying with injury to Yin, symptoms include body fever that worsens at night, vexation and insomnia, and in severe cases, occasional delirious speech. The mouth is dry, but there is not much desire to drink, or there may be faint macules and papules. The tongue body is crimson red, and the pulse is deep, thin, and rapid. 热逼心包的则渐渐身热着手，时时昏或昏不语，舌困黄燥，脉浊细滑而数。In heat blocking the pericardium, symptoms include body heat that feels burning to the touch, frequent clouding of consciousness with delirious speech, or stupor with inability to speak. The tongue may be stiff and speech difficult. The limbs may become cold. The tongue is crimson. The coating may be yellow and dry, and the pulse is often thin, slippery, and rapid. 4. 血分证 Hevel pattern 血分证是Ying分证的进一步发展。The blood level pattern is a further development of the Ying level pattern. It mainly affects the heart's function of governing the blood vessels and the liver's function of storing blood. 热伤血络，破血妄行，可见各部位的出血之症，吐血、爱血、便血、尿血。When heat damages the blood collaterals and forces the blood to move recklessly, various bleeding manifestations may appear, such as vomiting blood, nosebleeds, blood in the stool, blood in the urine, and macules on the skin. 肝血热盛，灼伤经脉，则出现倾向强直、手抽搐等中风之症。When heat is exuberant in the liver blood and scorches the sinews and vessels, signs of wind stirring may appear, such as stiffness of the neck and nape and convulsions of the hands and feet. 湿分热盛，湿热性子，说明血中经伤阴分。When heat is exuberant at the blood level, the tongue body becomes crimson purple, indicating that the injury to fluids within the blood is more severe than at the Ying level. 若血热炽盛，引起心、肝阴大亏，则可出现血少虚多之症，表现为低热持续不退，手足心热甚于手热、体消手，口干咽燥，脉象细数，或甚至出现虚风内动之象。is blazing and causes great depletion of heart and liver, then a pattern in which deficiency predominates and the pathogen is relatively diminished may appear. This manifests as persistent low-grade fever that does not subside, heat in the palms and soles that is more pronounced than on the backs of the hands and feet, emaciation, dry mouth and dry throat, a thin and rapid pulse, or an irregular and intermittent pulse, and in severe cases, signs of internal stirring of deficiency wind. 故血分有虚实之分，不可笼统而论。Therefore, blood level patterns are divided into excess and deficiency types and cannot be discussed in a generalized way. 3. 卫气营血病位的前身传变 The superficial deep transmission and transformation of Wei, Qi, Ying, and blood disease locations. 掌握卫气营先生对于了解正血的盛衰、病情的轻重、预后的凶和确定相应的治疗原则都有十分重要的意义。Yet, understanding the superficial and deep locations of disease in Wei, Qi, Ying, and blood is very important for recognizing the relative strength and decline of righteous Qi and pathogenic Qi, assessing the severity of the illness, judging the prognosis as favorable or unfavorable, and determining the corresponding treatment principles. 一般而言，微分病变最为轻浅，邪气出息，伤劲比较轻，故治疗较易。Generally speaking, Y-level disease changes are the mildest and most superficial. The pathogenic qi has just attacked. The heat tendency is not yet severe, and injury to fluids is relatively mild. Therefore, treatment is relatively easy. qi 分症较微深入一层，其实由表入里，引起多数脏腑功能的损害。The qi level pattern goes one layer deeper than the Y level. The pathogen enters from the exterior into the interior, causing impairment of the functions of many Zangfu organs. 但此期整体尚未衰，抗邪有力，若治疗技术正确，仍易获得良效。However, at this stage, righteous qi has not yet declined and still has the strength to resist the pathogen. If treatment is timely and correct, good results can still be obtained. 营分症未得到及时有效的治疗，邪热则可深入营分，伤及血中津液和心主生命的功能。If a Ying level pattern darn does not receive timely and effective treatment, pathogenic heat may penetrate deeper into the Ying level, damaging the fluids within the blood and impairing the heart's function of governing the spirit and consciousness. 也就是正气不足，表现为实中加虚之症，营分病变较轻浅，只要治疗得法，仍可望好转。That is, righteous qi becomes insufficient, presenting as a pattern of excess mixed with deficiency. But compared with blood level patterns, Ying level disease changes are still relatively milder and shallower. As long as the treatment method is appropriate, improvement can still be expected. 此分症是温病深重阶段，血热旺盛，耗血伤阴，引起心肝等脏器之损害和严重的功能障碍。若治疗不利，往往危及生命。The blood level pattern is the deep and severe stage of warm disease. Heat in the blood causes reckless movement of blood, consumes blood, and injures yin, leading to substantial damage and serious functional disturbance of the heart, liver, kidney, and other organs. If treatment is ineffective, it often endangers life. 由此可见，胃气营的传变是依次排列的。From this, it can be seen that the depth of transmission and transformation through Wei, Qi, Ying, and blood 分最浅，血分最深. The Wei level is the most superficial, and the blood level is the deepest. 但这并不绝对，也有特殊情况。However, this is not absolute. There are also special situations. 如热比心包，虽并属营分，但病情为重，并不比血分轻浅，这是值得注意的。For heat blocking the pericardium belongs to the Ying level, but the condition is critical and is not necessarily milder or shallower than a blood level pattern. This point deserves attention. 关于温病的传变 on the transmission and transformation of warm diseases. 关于温病的传变，有按胃气营血顺序依次传变的，也有不按顺序而特殊传变的。Regarding the transmission and transformation of warm diseases, the disease changes are relatively complex. Some transmit and transform sequentially according to the order of Wei, Qi, Ying, and blood, while others do not follow this order and undergo special forms of transmission. 简要介绍如下. They are briefly introduced as follows. 顺序传变. 1. Sequential transmission. 顺序传变即邪气从微分开始，依次渐加成T分，深入营分、血分。Sequential transmission means that the pathogen starts from the Wei level and then gradually moves deeper in order, transmitting into the Qi level and further penetrating into the Ying and blood levels. 这种传变形式反映了邪气由浅入深的过程。This form of transmission reflects the process by which pathogenic qi moves from the superficial level into deeper levels. 但大多数病变并不严格按这样的传变。However, most disease changes do not strictly follow this form of transmission. Special transmission. 特殊传变除顺序传变外，特殊传变主要原理即邪气不进微分，可以植入气分或植入营血。Special transmission refers to forms other than sequential transmission. The main type is direct entry into the interior, meaning that the pathogen does not pass through the Wei level, but may directly enter the Qi level or directly enter the Ying blood level. 同时出现2个或2个以上阶段的称为和谐，如微阴和谐、气阴和谐等。When 2 or more stages appear at the same time, this is called combined pathogenic involvement, such as combined Wei Ying involvement or combined Qi Ying involvement. 由此可见，病的传变虽有一定规律，但又不是固定公式，才能做出正确的判断。From this, it can be seen that although the transmission and transformation of disease has certain patterns, it is not a fixed formula. Only by basing judgment on the patient's specific condition can one make a correct assessment. 4. Treatment methods based on Wei Qi Ying blood differentiation. 叶天士指出，在微寒之科也，导气入营有可透热转气，入血恐耗血动血只需按血散血。叶天士 pointed out, when the disease is in the Wei level, sweating may be used. When it reaches the Qi level, only then may Qi clearing be used. When it enters the Ying level, one may still vent heat and turn it back to the Qi level. When it enters the blood level, there is concern that it may consume blood and stir the blood, so one must directly cool the blood and disperse the blood. 这段精辟的论述阐述了微气营血不同阶段的治疗大法。This concise and penetrating statement explains the major treatment principles for the different stages of Wei, Qi, Ying, and blood. 如血在微分，以是血趋于表。If the pathogen is at the Wei level, acrid cool herbs should be used to diffuse the Wei level and allow the pathogen to leave through the exterior. 叶氏指出，不重在发汗，因温病因热自伤津液，必须生之。Yi stated that treatment does not emphasize inducing sweating, because in warm diseases, heat itself injures yin. Sweating would only further damage the fluids, so it must be used with caution. 到气分，则以清气泻热保静。When the disease reaches the Qi level, the treatment should clear Qi level heat, drain heat, and protect the fluids. 气分病变多热抗症出现的治疗应以清热为主。In Qi level disease changes, heat is usually exuberant, so treatment should primarily focus on clearing heat. 到阴分，则以透热转气。When the disease reaches the Ying level, one should vent heat, but if the heat pathogen has already entered the Ying level, one must clear Ying and cool the blood. 在血分，则以凉血散血。At the blood level, treatment should cool the blood and disperse the blood. 热肾动血，治法必须止血。If exuberant heat stirs the blood, treatment must also stop bleeding. 热肾动风者，治法需凉血止急，活血养阴。If exuberant heat stirs wind, the treatment must cool the blood, stop spasms, invigorate blood, and nourish yin. 但在任何阶段，驱邪都应时时注意保静护阴。However, at every stage, when eliminating the pathogen, one should always pay attention to protecting the fluids and preserving yin. 另外，夜视妙用透自于有可止虚之间，必须反复调治。In addition, Ye Tianxi skillfully used the word vent between one may still and one must directly. The meaning is profound and must be repeatedly contemplated. 入血突犯未分，必须透血外出，不可急用苦寒清热，以免恶血入内。When the pathogen first attacks the Wei level, one must vent the pathogen outward and should not immediately use bitter cold herbs to clear heat, in order to avoid constraining the pathogen and driving it inward. 若血易入血，即微气营血中最深入一层，非通用咸寒清热之品，则难以直达病所。If the pathogen has already entered the blood level, which is the deepest layer among Wei, Qi, Ying, and blood, then without using substantial salty cold heat-clearing substances, it will be difficult to directly reach the disease location. 这些原则对于疾病的治疗用药并有重要的指导意义。These principles have important guiding significance for the treatment and medication of disease. Sanjiao pattern differentiation. 三焦辨证是呼居夜视卫气营血辨证方法之后而创立的又一种温病辨证纲领。Sanjiao pattern differentiation is another guiding framework for warm disease differentiation established by Wu Jutong after Yan Shixi's method of Wei Qiying blood differentiation. 其依据是内经和南经理论，尤其南经31难对三焦功能和部位的论述。 Its basis lies in the theories of the Huangdi Neijing and the Nanjing, especially the discussion of the functions and locations of the Sanjiao in Nanjing. Difficulty 31. Nanjing, 31难, Sanjiao 为水果道路7之所重视. The Nanjing, difficulty 31, points out that the Sanjiao is the pathway of water and grain and the place where qi begins and ends.